are glad to have you here. I am so honored. I'm Pastor Corey Kennard from Amplify Christian Church. I'm also in the field of healthcare as an administrator. And I want to let you know that today you're in the right place at this hour. We have Dr. Roy, who's going to introduce herself as well. And we are excited to be together for the first time doing this webinar, dealing with COVID-19 and how it has impacted the African-American community and the community at large. And we're going to get some good information today from Dr. Roy, and I'm excited to finally have this to come to pass. This is something that has been on my heart, not only for our ministry, but the community that I serve in and all those who are connected with me. You know that I've been wanting to just interview one of our great doctors in the community and to try to get some more information to you as it relates to what we can all do to battle this horrific disease that's invading the community at this time. So right now, I would like to have Dr. Roy to simply introduce herself. Would you introduce yourself, Dr. Roy?
No problem. It's an honor to speak with you, Pastor Corey, and all of those that are attending today. My name is as Pastor Corey said, is Dr. Roy, R-O-Y, and I'm with Associates of Integrative Medicine. We are north on Woodward in Bloomfield Hills on the corner of Square Lake and Woodward. And our job is to see cancer patients for the side effects of chemotherapy, radiation surgery, and also to lower risk of recurrence once people have been diagnosed or slow progression, so they do well in survivorship. As such, we do a lot with hypertension, diabetes, heart disease, because all of those things play into the fight against cancer. And we usually end up having lifelong relationships with our patients as we worked with them towards optimal health. To find us, just go to AIM Natural, Associates of Integrative Medicine Natural.com, and we'll circle back later to talk a little bit more about how I serve you. But it's an honor to be here today. Oh, I forgot to mention one thing. I'm what's called an integrative oncologist. I didn't even say that. So I'm a natural medicine doctor, but I'm a fancy kind. So that means I have both the conventional medical training and the training in natural therapies. My job is to bring the best of both worlds, so natural therapies, nutrition, and conventional medicine to a cancer population and to the population at large. So that's where my background is.
Excellent. Thank you so much. So as you see, everyone, we have a great doctor or physician on board, and she's going to be able to give you tons of information. I want to go right into this topic, and it's really the topic of today. And I know that some of us are fatigued as it relates to even talking about COVID-19. It's something that we've been dealing with since here in Michigan, as it relates to the shutdown since early March. And to be quite honest, being in the hospital, it's been rough. And I know that there are some statistics in the community that relate to how people or different people are being impacted by COVID-19. And Dr. Roy, if you can just share with us what you've witnessed personally as it relates to the impact of COVID-19, maybe on your practice or even with your patients.
So I think that's a really interesting question. I think the most obvious impact is we haven't been able to see patients in person. So we're mostly telemed right now, unless someone is critical care. So we do home visits when it's necessary, but we do need to quarantine in between those. So we're really used to really long visits and really intimate relationships with our patients, being able to see them and their families at the same time, because as you know, when you're treating a patient, you're treating the family. So it's really important to get a sense of how they take up space, how they move, how they interact with each other. And we don't have that anymore, right over the computer, even seeing new patients that way. I think that distancing impacts how we deliver that care and also how the patient experiences our presence and the warmth of that presence. I think the second piece in terms of how it's impacted our practice is we had patients pass early on who were cancer patients or cancer patients in treatment. And we had to move really fast to institute protocols for our patients to support them and prevent that from happening again. And that was really hard because we usually walk our patients from beginning of diagnosis through the end of their lives, whenever that may be. And usually I'm young enough to keep walking with them. But in this case, we like to be in the home or in the hospital with them. And we were not able to do that. So having to be with family members in the parking lot of the hospital, having to create kind of communities of around being able to support the person who is in the hospital remotely. For example, prayer circles, honoring the spouse's intent, as you've talked about with me personally, something that you're doing in patient services at Ascension, knowing how to advocate for yourself when your loved one is on a COVID floor. We were successful in getting loved ones in with their loved ones as they were passing, but that required pulling a lot of strings, and it required a lot of stress on relationships. And then the third thing that's really, and that was devastating, to be honest. For me, I really think being able to stand with my patients at any part of their journey is my moral imperative as a physician, and not being able to do that because of the risk associated and the policies in place, especially in the beginning when it was more chaotic, was really stressful emotionally and on the practice. And the last piece is that our patients who are newly diagnosed and patients who are continuing to receive care are having treatment delays. So because of COVID, particularly surgeries are being delayed, and that's very stressful for a newly diagnosed population where surgery is usually the first option. It's curative and it's standard of care. So for that population, being able to, one, manage anxiety, which is a huge piece of what we do, two, being able to make sure that we pull the right strings to get them into the kinds of treatment they need, three, making sure they're on natural therapies and drug treatment that will lower the risk of progression while they wait, and four, prioritizing their needs so that they do get surgery as soon as possible. That's been, a balancing act. So even though we're seeing less patients, we're actually doing more work to manage the kinds of complications that we're seeing.
It's a great thing that you brought up about the way that you see medicine, not only from a natural standpoint, but from a human presence standpoint. It's so important in the hospital. What we've been able to do, like you just said, is to connect those patients with their family members. As we know, visitation is slim to none as it relates to patients in the hospital. But with the use of iPads and technology, we've been able to at least make that connection, which has been huge and monumental to the emotional health and psyche of every patient that we've been able to make that connection with. And so definitely the work that you're doing, it sounds like you're still trying to advocate in whatever way you can as relates to your patient population, even though you cannot physically be with all of your patients at this time. And as we know, and this is a difficult topic, but the death rate of African Americans as it relates to COVID is huge compared to other groups or other culture groups or other races. And what we're seeing now, and the last figure that I heard was that out of the confirmed cases, there was an almost 60% death rate among African Americans. And particularly here in Michigan, when the first numbers came out, with African Americans being 14% of the population, but yet 41% of the death rate, that is alarming. Can you talk a little bit about why that is so, or what you're seeing as a contributing factor or factors to that high death rate among African Americans?
Yeah, it is startling, but it's also to be expected in the sense that it mirrors health disparities in care. So as you said, in Michigan, African Americans are 14% of the population, yet we're seeing the majority of the deaths coming out of our communities. In Louisiana, where African Americans are 32% of the population, we're seeing 70% of the deaths coming out of Louisiana. And in Chicago, which is right next door, 30% of the population is African American, but 70% of the deaths are Black people. And out of that population, most of them are in 5 neighborhoods localized in the south side of Chicago. So I think it's really important to understand that it's not that the virus targets Black people differently. It's that the infection rates are different because for many of us, race is home. And there's a couple of factors at play here. I think the first factor is historical and really important to understand. The best way to prevent infection of the virus is social distancing, as we all have heard. But social distancing is an anathema in communities that are really interdependent. So to survive slavery, to survive civil rights in the Reconstruction era, to survive moving through our journey as Americans, Black folk have traditionally had to rely on community. I mean, that's true for our Arab American communities as well in this state or in this city. And what that means is we may not trust a babysitter or a nanny, but we definitely trust our aunties and our cousins and our neighbors to watch our children. And there may be even 10 children in a house. It's not a traditional childcare situation, but it's how, as Black folk, we manage our children. If someone doesn't have food, then you may bring food to someone's house. You may be sharing food on a Sunday. We're just very reliant on community. And so in communities where community is so integral to the fabric of how people function, social distancing not just doesn't work, but it almost has a race component in that there was no cultural education around how to implement social distancing in those communities. And then the second piece is understanding that in communities where community is valued, we live closer together. So especially in socioeconomically depressed or less advantaged areas, it may be that we have several families living in one house. And a high value or a high priority in our communities of origin, in my case, my mother is African, my father is Indian. Elder care and child care kind of are generationally connected. So we may have 2-3 generations living in one house or 2 or 3 families, and we don't really think of cousins and extended relatives as being separate from us. They're all really just family, what we call family, right? And so social distancing doesn't work. Infection rates are higher where we have denser groups of people. And the other pieces are around prevention. We're really working with our population and making sure people do not go to the emergency room or the hospital unless it's absolutely essential, meaning they cannot actually breathe, or they have symptoms of a stroke or a seizure. So patients now have my cell phone number, which has been interesting to make sure that they don't go to the emergency room. But for Black folk, there is a historical mistrust of the medical community, of the information community. And there's a lot of information that's traveling word of mouth about how the virus is transmitted that may or may not be correct. And there's a lot of dismissal of the information that's coming from higher levels like the government because they can't be trusted. And the historical distrust in the medical community is valid and I think real and comes from real events in our history. And if we don't understand that as legislators and physicians, we cannot reach this population. And it's essential that we do because it is the population that's most strongly hit by this virus and is going to have the largest socioeconomic impact as we move forward. I think the last piece is as people have not been able to do non-essential jobs, how often in your auntie's lifetime has she gotten this much vacation time that she hasn't had to pay huge consequences for? So, you know, to treat it like it's just a holding pattern and not a time of joy and a time of connectedness, I think also is antithetical to how we think as Black folk.
And so, you know, as we can see, and thank you for that. I mean, that was a very thorough answer to the question, and a lot of information was packed in that. If we can unpack it just a little bit, as it relates to the perceived lifestyle of Black people in this country in terms of how we eat, the stress levels, those socioeconomic factors, those social determinants of health. what are some of those things that stick out to you that even you as a doctor are trying to help Black people as it relates to living better or doing better? What can be done to have such a devastating disease not be so impactful on one community like it is hitting the Black community?
So Pastor Corey is doing a really good job of reminding me of something that I forgot to mention that is a core piece of why African Americans are being impacted by COVID the way that they are. And that is that the comorbidities, or the things that put us more at risk or most at risk with this virus, is having hypertension, diabetes, severe obesity, so that would be a BMI of over 40, not just being a little chubby, or cardiovascular disease. And we know that even just as Americans as a whole, 1 out of every 3 of us have hypertension, 10% of the population has diabetes, and 40% of the population is obese. And that's Americans as a whole. So when you think about that in the Black community, how much higher those numbers really are. So it really begins with lifestyle choices, as Pastor Corey is pointing out. You can empower yourself here. It can be a time to start thinking about reversing a lot of those outcomes. And those outcomes, hypertension, diabetes, obesity, are reversible. And to some extent, even cancer. You have some play here. 60% of all cancers are related to lifestyle choices made earlier in your journey. So I think if we use this time to really focus on our, as you mentioned, high quality nutrition, but also critically sleep and how we sleep, and we can unpack these as we go. So nutrition, sleep, stress management, and exercise, movement. Those 4 pillars, if we can really focus on those 4 pillars, nutrition, sleep, exercise or movement, and stress management, how we look at those 4 things, if we transform our relationship with them, we can start to transform not only our relationship with this COVID disease, but our relationship to the healthcare system in general. There's nothing more expensive, I tell my patients all the time, than being sick. And there's nothing that makes you more of a cog in a wheel or a number in a system than getting sick. So part of the ways that you can empower yourself and disconnect from that medical system is looking at prevention.
So nutrition, sleep, exercise, and what was the 4th?
And of course, the stress management. So let's start with
stress
nutrition.
management.
Yeah.
All right. So let's
nutrition.
All right. Let's start with nutrition. Let's go there. So I know that as I shared with you that I have, and this will be 3 years for me this month, taken on the vegan lifestyle in terms of eating. So, no dairy, no meat, and nothing with a face, right? And that's been a personal choice for me. And it's been, as I mentioned to you, very beneficial to me personally. Now, I know that the vegan lifestyle may not be for everyone. I do understand that. And so, but with that being said, I do believe that on the other side of that, there are some things that we are eating as Black people that have proven to be very detrimental to our well-being. Fried foods, I'm going to say the abnormal chicken size that comes from certain restaurants. We won't call them out right now, but the way things are prepared. And I know that, from a natural medicine standpoint, that has to involve it has to involve natural ingredients and natural foods that you promote. So what are some of those things that you do promote that can be preventative measures to keep us from some of these underlying conditions that have impacted us health-wise?
So Pastor Corey is putting me all to shame, of course, with his transition to a vegan diet. He's right that while that has worked really well for him, it may not be the best choice for everybody, but there are a few simple choices that you can make. One, eating more fruits and vegetables. So if you picture your plate as a circle and we divide it in four, so now we have four pieces of the pie. If we can switch our side dish of broccoli and our main dish, the 3/4 of macaroni and cheese, so that the side dish is macaroni and cheese and our main dish is the broccoli. And you move towards that slowly, right? You don't all of a sudden get there. But the more fruits and vegetables that you can incorporate into your diet so that you can move towards 3/4 of your diet as fruits and vegetables, the better your outcomes are going to be, particularly with colorectal, breast, lung, and prostate, which are the most prevalent cancers in the Black community. Colorectal especially responds beautifully to diet. The other great thing about eating lots of fruits and vegetables is the colors that they have in their skin. That pigment, that dark pigment, actually is cancer fighting, but also antiviral. And it supports your immune system by doing something called scavenging. So when you eat fruits and vegetables, what the actual living pigments do in the skin of those fruits and vegetables is they move throughout the body and look for cells that need repairing, that are damaged, trash that needs to be taken out. So they're like a garbage collector, and they clean out the system. So they're really, really important. The second thing that I think you can do that's really important is eat less. So I know if any of you have inherited your china from your grandmother or your great-grandmother, you see those dinner plates are really small. But now our dinner plates are huge. If you go to Cheesecake Factory, we have a portion size that used to be for 4 people, 5 people, and now it's just for 1. So eating less is really important. And why? The amount of fat that we're storing and the amount of calories that we're storing make energy or nutrients available to things like inflammation or infection or cancer. So you want to restrict some of that nutrition, and there's a couple ways to do it. One is eating less, one is fasting, and we can talk about that more if it's of interest to the group. I wanted to point out, I think you guys can chat with us. So if you, can they ask questions on the right there?
I'm not sure.
Okay,
I
let's
believe
ask
they
Kyle.
can. Yeah.
Okay, perhaps they can. So if you do have questions, we should be able to see them. The third piece is eating. Yes, they say we can.
Yeah, I see them now. Okay.
Thank you, folks. So definitely ask your questions as we go so we can keep this as relevant to what you need to hear rather than what we like to talk about. The third piece is eating more whole foods. So especially in stressed communities, we tend to be really dependent on things that come in a box, bag, or a can. And those things which are stored in the middle of the grocery store are less healthy for you than things on the outside of the grocery store that are not in a box, bag, or can, except for beans. So beans and legumes in a box, bag, or can are fine. Everything else you want to aim for at least half of your diet to be things outside of a box, bag, or can. So if you can just follow those 3 simple rules, eat more fresh fruits and vegetables, aim for foods that are not in a box, bag, or a can, and try to eat a little less, you will be 50% of the way there to being ahead of the population in terms of prevention of disease. Okay?
Now, so they have something called the quarantine 15. And that is, people are saying that during this time period of staying at home, that the potential of collecting 15 additional pounds to your weight is something that is very probable because you may not be getting out and doing those things. And so it becomes really a mental battle or struggle to make sure that you're not just eating and then not getting any exercise. And someone says guilty on the chat. So so I would like to just say that it's important for all of those who are listening to make sure that you take heed to Dr. Roy's advice of eating less, but then also, we'll get to exercising in a moment, but we have to move as well. So staying at home doesn't mean just sitting down at home, doesn't mean not doing anything at home. It means that we can still be active, and then we can watch those ingredients that or those foods that we eat each and every day. One person, as it relates to nutrition, brought up fasting. And from a spiritual standpoint, fasting is a part of the faith community. And I believe it is a natural way of God replenishing the body and having us to do, having our bodies to be optimized in the best way possible, because eating is just not good for us if we don't take that break and give the digestive system some sort of rest. So it's not just a spiritual thing, but it's also a physical thing scientifically. And so can you speak a little bit more to what you see as the benefits of fasting?
Mm-hmm. So it's just exactly what you said, and there is some scientific value behind it. So first of all, I want to talk about intermittent fasting. I think Sean asked that question. If you can't eat less, a good way to introduce less calories into your intake is to eat at some point at night, to eat dinner, but then extend the time between dinner and when you eat your next meal, which would traditionally be breakfast. So you want to get to at least 12 hours if you can, so 8 to 8, for example. But if you can't, then you don't necessarily get those benefits. But if you can get a little bit over 12, if you can get to 14 or even 16, you get even more of a benefit from it. And it reduces the time during the day that you're actually consuming nutrients. Now, the reason why it's beneficial for us scientifically is when, as Pastor Corey said, we give the digestive system a rest. Actually, cells all day long are making daughters. So every cell in the body is dividing. Each cell is making 2 daughters, each daughter is making 2 more, and so on and so forth. When we fast, we introduce what's called cell senescence. So it becomes a quiet time where the cell actually pauses in development, all these billions of cells, and it looks for errors and repairs itself, or it looks for errors and designates that cell for death. And that is what prevents cancer and other kinds of inflammatory diseases. So it's really actually a critical strategy for those of us that are trying to lower our risk of disease. And I want to just reach out to our Muslim friends. It's also Ramadan right now, so fasting is not just for us as Christians, but also for us as Muslims. It's a way of returning to that place in ourselves that's always hungry for something to feed the pain or feed the need, right? Our relationship with food is really strongly connected to our emotions, connected to home, connected to hearth. Our first relationship with our mother is on the breast, is breastfeeding, and that eye-to-eye contact that you get as a baby that you don't remember, but gets hardwired into you, the association with love, the association with warmth. And I think fasting allows us to get closer connected to what we're not doing in our lives that we can't necessarily fill with food. So I want to finish with fasting. I don't think it's the most critical thing that we're talking about today. And I want to just quickly talk about movement since you brought it up. Movement is medicine. You were designed to move. You have these big joints that swing your full range of motion. You've got big butts, a very strong muscle there that's made to actually move. When we don't move, we die. So movement, even if we're lying in the ICU, there's actually systems, electronic systems that cause compression of the muscles, and people who are assigned to move that person, because if the person is not moved, they will actually decline very, very fast. That's how important movement is to the human body, and particularly to those of us who have hypertension and heart disease. So you have this pump that you're born with, and it's pumping all of this fresh blood out to the body all day long, 60 times a minute. Here it goes for the rest of your life. And that fresh blood is bringing nutrients from the head to the toe. But as it gets down to the toe, there isn't a pump to bring it back up. The only way you bring it back up to the heart is by moving. Movement compresses the veins, and there's a backflow valve so that the blood will move back up to the heart and then get replenished with oxygen. So if we don't move, we actually don't deliver nutrients throughout our entire body. Make sense?
Powerful. You heard it. Now you heard the doctor, and let's heed the doctor's advice because it's both spiritual and physical as it relates to fasting and then even movement. But also something that I'm guilty of Dr. Roy, and I'm just going to be honest with you. I'm guilty of not getting enough sleep. And I know I'm not alone. I know that there are other people out there who just don't get enough sleep. The real question is something that I don't think we've talked about enough. What is enough sleep? And then do the hours of sleep matter in terms of the clock time? I've heard, between 10 p.m. and 2 a.m. are the most optimal times to sleep.
2 a.m., Pastor Corey.
I know, but I mean, it's as it relates to being asleep during those hours, is most beneficial. But, remaining sleep past 2 a.m. definitely. But I want to say that, and to be realistic, getting 4 hours of sleep, I know is not good. And I need to do better. And I believe we all need to do better. But I believe stress plays a role in that too as well. So can you talk about those two points out of the four that you made, both sleep and stress, and how they impact us from a health perspective?
Sure. So sleep is actually evidence, meaning there's clinical evidence that shows that it upregulates your immune surveillance and helps you to fight disease and repair cells. You notice that when people don't sleep, that's when they get sick. You also notice that when people don't sleep, that's when they get their big tummy. And when people don't sleep, they're irritable. We don't know why we sleep, but isn't it curious that at some point in our life cycle, we need to lie down and close our eyes and really not be conscious for a period of time? It's how we were designed, or evolved, whatever you created. It's part of God's, if you believe that, or if you don't, it's part of natural design. And it's actually essential to the organ. What we found is that people who don't sleep, like let's say we kept each other awake for 3 days straight with no sleep, that actually a permanent psychosis will happen in the brain, and the brain is damaged. So there's a couple of things that are happening when we sleep. And again, I want to remind people, AIM Natural, I'm going to type it into the chat box here. That's our website. And if you go to our blog on there, I actually wrote a piece on sleep a couple months ago that I think is useful in outlining the physiology of it. But when we sleep, we are doing a couple things. We're consolidating memory, and it's why we have memory issues when we don't sleep well. But we're also organizing information. So the brain actually needs to take all of the images and all of the data it got during the day and store it or file it. And it has difficulty doing that if you're not sleeping. And the last piece is, like I said, supporting us in immune surveillance. The best time to sleep, Pastor Corey, is actually around 10 p.m. Now, it can be a little bit earlier, it can be a little bit later, but the reason why is we have an internal biological clock. Again, all of this is by design, and that clock actually releases certain hormones to manage the regulation of how you use fat and sugar. This is why we gain weight when we don't sleep. And it's because if we're sleeping around those times, it allows the hormonal balance to follow the rhythm of the Earth's movement, so from sunlight to daylight. And some of that is connected to dark, when we're exposed to darkness and when we're exposed to light. For example, night shift workers have a 60% higher risk of certain cancers like colorectal, lung, and breast, sometimes prostate. And that's because even if they may sleep during the day, they're exposed to light during the time in their rhythm, their circadian and biorhythm, when they're supposed to be exposed to darkness. When we're exposed to darkness, there's actually a gland in the brain that makes a hormone called melatonin. You might have heard of that. Melatonin is not a sleep hormone. It's a hormone that's in response to darkness. When that hormone is produced, it's responsible for telling the immune system how to function and how to repair things. So it's super essential to sleep around 10 p.m. And then whenever you wake, it's good to wake as you wake normally, so between 5 and 7 a.m. Now, you should be sleeping in a dark room because that'll help your brain to be cued into that cycle. That room should have high quality air. There's a video called How to Grow Fresh Air on TED TV. How to Grow Fresh Air on TED TV. It just tells you about a couple of plants that you can put in your bedroom that'll help you with high quality air if you can't afford an air filter. The room should be cool to cold. Having a cooler or colder room helps people to regulate hormonal health at night. And there should be some sort of noise distraction if you need it. If you struggle with stress, there's some excellent guided visualizations on healthjourneys.com. It's a website that posts guided visualizations specific for health problems, particularly things like cancer, heart disease, diabetes, and sleep disturbance. And you may want to have a protein snack before bed, something with like as our parents used to do for us. I'm dating myself. We used to do Ovaltine, a little bit of toast. The reason our parents intuitively knew to do that was a little bit of a protein snack before bed will regulate your sugar. So it could be an ounce of oatmeal with a little bit of almond butter in it. It could be whole wheat toast with almond butter on it. Could be turkey, cheese, and crackers, although meat may not be the right choice for you, etc., etc. Anywhere between 45 minutes to an hour before bed. I'm typing these tips out because I'm saying so much information. I want to make sure people are catching it. If you struggle with anxiety before sleep, it's okay to do a guided visualization or 200 milligrams of theanine, which you can get over the counter. It's a non-narcotic, non-habit forming anxiolytic that works just like Xanax, but it's actually an extract from green tea. It's safe has no contraindications with drugs and safe for everybody, even babies.
Excellent. You put a lot in there. How to grow fresh air. I really love that. And should people sleep with some type of noise, music? I know that there's music that can be played through the night. Is that healthy, or is that something that somebody just made up and said
it's
this
not
is
something
good?
somebody made up. It is helpful. It's helpful if it's a noise distraction. So if it promotes delta waves. So if you go on YouTube on your phone, you can find sleep music that you can play, or even just the sound of an air filter or ocean sounds, if those are helpful.
Mm-hmm.
They do actually promote deeper sleep. I think definitely there's a long-term study through Harvard that looked at something called mind dumping. Writing in your journal, particularly with your non-dominant hand. So if I'm right hand dominant, using my left hand to write down stream of consciousness, anything that's bothering me, all the stuff that's rattling around in my head, and then put it away before people go to sleep. But over a period of years, their sleep improves.
Mm-hmm. Now, someone asked 200 milligrams of what was that you mentioned?
Theanine, and I put it in the chat box. Are people not seeing that my chat to you guys?
Mm-hmm.
Perfect.
Theanine. Got it. Excellent. Well, so nutrition, sleep, exercise, and then stress. And stress can be helped with the right amount of sleep, sleeping at the right time, and doing those things that are necessary. It's interesting how there is a health difference between those who work at night and those who work during the day. There can be. And it's very interesting. Glad you brought that point up. So should now you may have individuals who work at night, afraid to work at night. What can we do to ease those fears, since you brought that up?
Mm-hmm. So those of you who are working at night, there's that you can wear a pair of red goggles, red sunglasses. You can get them from Amazon or talk to your doctor about them. They filter out some of those harmful light and keep you from lower your risk just slightly. And then when you do go to bed, you should be using melatonin, but it needs to be in a high dose. So I'd rather you call me directly or email me directly and ask. I'm hearing that people can't see the notes that I'm putting on the chat, that they're only going to Pastor Corey and myself. So we'll make sure that everybody's able to see it. If my IT person can help us out with that, that would be helpful. And then we'll get those up to you guys. Don't worry about it. And then the third thing is if they can use a night mask. So one of those blindfolds that people wear at night. If you go to etsy.com, those are local artisans who make really healthy, nice masks that you can wear at night.
Beautiful. Excellent. So back to COVID-19, and really the topic that's taken up all of our lives. I know that many people have, heard of different ways in which they could try to avoid this, and a lot of that is an error. A lot of that is out of ignorance. We've even been, it was suggested that, Lysol and things of that nature. I mean, and we don't even want to go there, but, we've heard some outlandish things as it relates to preventing this and not contracting it. But there's also some, what I want to dwell on, though, is that we have some things in our home. I know in growing up, there used to be some home remedies that we would take in order to feel better, to get over colds and things of that nature. What are some good things that are right there in our homes that we can take and take part in to help to continue to not only boost our immune system, but even maybe get over, it may not be COVID-19, but any other illness or sickness that we may have?
I think it's such a good question, and it's such a dear question to me. My grandmother was kind of I would say a voodoo healer in our neighborhood or our village when I was younger, and she used to work a lot with herbs, and people used to stop by. She had a little shop at the end of her driveway where she would make wedding gloves and wedding dresses by hand, and people used to stop all day long and ask for remedies for different kinds of ailments, even things like my husband isn't talking to me anymore, or my sister is needs to get this job, whatever it was. And I think it's really important to remember, as we've moved in our journey as Black folk in this country, we've become, there was a dismemberment or a separation for us from our ancestral roots, from how we think about health and what remedies we did have access to that are part of our historical memory, but we may not have access to, but things that we kind of remember, like Vicks mentholatum, for example. Remember, your grandmother used to put that all over your chest.
Oh yeah, just all over.
Right, all over, and then she'd give you a little bit to swallow, right? So that actually comes from an African heritage of using eucalyptus root. And if you look at the ingredients on Vicks, which is, a major multinational corporation, or owned by a major multinational, in it is actually eucalyptus and petroleum. Now, petroleum is not good for us. It upregulates breast and prostate cancer. But it's coming from that tradition of using eucalyptus root as an antimicrobial and to help us breathe when we were earlier in our history. So I think it's really important during times of stress like this, and times of anxiety, uncertainty, to return to our roots and start to think about remembering some of those things. And they can be hard to access, but through meditation and prayer, they can come to you. And that's really important. I don't want to dismiss that. I think in the healthcare community, we're really afraid to talk about prayer. We're really afraid to talk about prophecy. We're really afraid to talk about visions, dreams. We're really afraid to talk about what comes up for us when we're listening with a different ear. But I think the best doctors do listen with a different ear. And being able to listen to a different ear yourself can help you to access some of those things. So I'm going to talk about them, but I want us as a people to start remembering what was dismembered or taken from us. Does that make sense? In terms of natural remedies, so I mentioned eucalyptus, lavender, tea tree oil are all antimicrobial. They're essential oils. And I should say a disclaimer, the government is actually fining pretty heavily natural medicine doctors and doctors in general who discuss natural therapies at this time, especially to prevent COVID. So I want to emphasize, one, the only prevention is social distancing and healthy precautions. So washing your hands, making sure you're not touching your eyes, ears, nose, mouth, which you've seen me do many times during this. And making sure that you wear a mask when you're in public, and even glasses or goggles, because the virus can enter through your mucous membranes, your eyes, ears, nose, mouth. That is technically the only prevention for the virus. I also want to say, I think there is some race issues around how the medical community is responding to people's natural and healthy search for how we can support our immune systems naturally. I think that's really important, and I don't think it should be dismissed. I think there should be a forum for people to be able to discuss it. So garlic, ginger, cayenne, all of those things are antimicrobials. Any spice that smells, we call them aromatics. So salt is not an antimicrobial, but it is an antimicrobial, I'm sorry. Salt is not a cancer fighter, but pepper is. So any aromatic spice will lower inflammation in the body and fight disease. Salt, if it's used as a gargle and as a nasal rinse, is helpful to prevent colonizing of the virus if you've been exposed. So, for example, I may have had an exposure earlier. So one thing I introduced was a neti pot. You don't need to get something fancy. You can just take a cup, put a little bit of colored salt in it, add hot water from the shower, and just pour it in one nostril, let it come out the other, in the other nostril, let it come out the other. You can gargle with it and wash your face with it. And salt is a nice antimicrobial. I'm sorry, my IT person is asking me one thing. Did you need something? No, he's good.
Okay.
And ginger, garlic, cayenne, if we can take those and really mince them up and put them in a base of lemon juice, raw honey, so manuka or raw honey in a glass jar, and then add whatever you wanted to add to it, either beef bone broth or another kind of juice, mix that up and take it as a tonic every day. You might have heard of that as something your old folks or your grandmother or grandfather talked to you about when you were younger. Those things are also very helpful to support your immune system. And I'm missing a ton more. I'm noticing that Dr. March is on the top. Dr. March is our oncology nutritionist and an expert in nutrition itself and how to use it to prevent disease, how to use food as medicine. So I'm sure I'm missing something, but I'm waiting for her to type some suggestions to me.
Hello, Dr. March. We want you on next time as well. So we want to see everybody that's doing some great things over at aimnatural.com. And we want you to go to that website. Those things that you didn't mention, Doctor, I'm sure are on that website somewhere, right? Or if not, that people can
usually not. So yeah, usually not. And the reason why, Pastor Corey, is nutrition and natural therapies and medical care is individualized for our practice. So every person is treated as an individual. For you, a vegan diet has been very successful. And you may have a high amount of colorectal and prostate disease in your family. And if you did, then for you, a vegan diet, the diet is actually curative and therapeutic. But for somebody else who's trying to get pregnant, a vegan diet would be disastrous. For example, for a young lady who's trying to get pregnant and having difficulty in doing so.
Well, I want to let you know that I did see a snippet of Dr. March's video, and she talked about things being individualized. And so that's a key thing. So what we want you to do first is put any other questions that you have up on the chat so that we can address what you want to know about. And then secondly, we definitely want you to go to aimnatural.com, AIMnatural.com, and go to that website. You can ask questions, you can find out more, you can put in your information, and they will get back with you. But I think there's some fantastic things that they can offer to you on an individualized level. And so, and I do want to say this, and I know that she's on this somewhere, but Chanel Smith, I want to send a shout out to Chanel Smith, who's a part of our congregation at Amplify. AmplifyChristian.church is our website. You can follow us on social media as well at Amplify Christian Church on Instagram and Amp My Life on Facebook. But anyway, Chanel is the reason why we were able to come together and have this conversation. She connected us. And so we thank you, Chanel, for bringing us together and making this moment possible. And I believe it's going to be beneficial. Yes.
Paying it forward. There were a list of questions, Pastor Clay, that you had sent me that the viewers had asked about. I wondered if we should maybe go through some of them.
Yeah, let's go through some of those.
Okay. So one of them was, how can we boost our immunity response? So we talked about sleep. We talked about movement. We haven't talked a lot about stress. I'm hoping to get to that towards the end. Definitely introducing garlic, ginger, cayenne, and other things into our diet. Definitely focusing on high quality foods, introducing a lot of fruits and vegetables. A couple of therapeutics, so vitamin C, 500 milligrams, a couple of times a day is helpful for you. 2, bowel tolerance, so it can cause diarrhea. So you want to make sure that you dose 2 loose stools and then back off a bit. And then in addition to vitamin C, vitamin D. Our vitamin D levels in this country, particularly among African Americans, are very low. The norm is considered about 30, 35, and usually your doctor doesn't care as long as you're at a 30, 35, but that's not enough to prevent disease, particularly cancer or infection. You need to have a vitamin D level of at least 50, and it's hard to get there if you're not taking some sort of supplement.
So it's not just getting out in the sun and getting that vitamin D, but it's taking supplements, vitamin D supplements that can help.
That's right. So vitamin D actually is not super well absorbed in Michigan because we have such little exposure to sunlight. So unless you were willing to move to Barbados, you wouldn't be able to get that therapeutic level that you need to fight disease. And for Black folk, it's even more important that we have that high serum level of vitamin D because we're more at risk for cancer, autoimmune disease, COVID, cardiovascular disease, and vitamin D is protective. Now, if you do have symptoms like a cough or a cold, that symptoms of COVID, you should stop the vitamin D immediately. Another thing that's gotten a lot of play are mushrooms. All mushrooms are cancer fighters. However, most of them are sourced out of China. So I don't want you taking them as a supplement because in this country, supplements are not well regulated by the government. They're regulated by the USDA, like a banana. They're not regulated by the FDA, like a drug, which means that there can be problems with source, contamination, dose, and people can say things that aren't true. So there's a lot of sophisticated marketing around supplements. So one of the things we're doing in our practice is making sure that you have access to pharmaceutical grade supplements that are individually tailored to your particular risk and your particular symptoms at the doctor's prices so that you're not actually out there in the world being subject to all sorts of marketing. We don't sell those, but we make them available to you and help you to access what you need for your care. But yes, vitamin D is safe over the counter, and you should try to get your serum level, that is your blood level, to about a 50. The best way to improve your immunity response is to sleep. How does exposure mean contracting the virus was the next question. Did you have a point on that, Pastor Corey?
Well, definitely. I think that people are, we ask the question when we screen in the hospital, have you been around anyone that has tested positive for COVID-19? And so, people are automatically thinking that, okay, I was around this person, they have it, so does that automatically mean that I'm going to get it? And I think that that's a question that people have and a fear that people have because so many people are asymptomatic, which is another question that someone wrote down. Being asymptomatic, why are some people asymptomatic and may not ever show signs of COVID-19 with a sneeze, a cough, a fever, and then why do some show every sign, so to speak, and they can be, maybe in the same house, So
coronavirus, coronavirus is actually an umbrella term. There are many coronaviruses. They've been around for a long time, and the difference between this coronavirus and other cold and flu viruses is one that it's transmitted so easily. It lives on surfaces for a little bit longer than typical viruses do. So viruses are just a plasma envelope of a little bit of DNA. They're not really living creatures. They're almost like mucus from your nose. They're just a little piece of slime, a little plasma envelope with a little DNA in it, but you can't see it. It's invisible. It's microscopic. So what happens is because it can live on surfaces for longer than the average virus, it's easier to pick it up. If I go to the store and I pick up a box of macaroni and cheese and I look at it and I cough on my hand, and then I take that same box and I put it back, I decide I don't want it. But you come by 3 days later and pick up that same box, say, I'm going to take this home. Your son goes to make it and he rubs his eyes. That's how the virus is being transmitted. Does that make sense? So there was a question about wiping down your packaging when you get home, and yes, you absolutely should. In terms of what you can use at home, the CDC has a household cleaning handout that'll help you to figure out what to use. But anything with bleach, alcohol of 70% or hydrogen peroxide is good. Simple Green is a brand that has a natural blend, and Simple Green, I wrote Simple Brand. That brand has some antiviral and antimicrobial activity. If you need to make something at home, a cup of bleach, hydrogen peroxide, or vinegar even, to a gallon of water is good for cleaning surfaces. In terms of when we encounter the virus, so 50% of us are asymptomatic carriers, and that's another way that the virus is getting transmitted. And the reason why is most of us have a healthy immune system. So when we encounter a virus, we develop soldiers or antibodies to lock and key with that virus, and then we store the memory of it and we move on with life. We have no symptoms, or we have symptoms much later. And so because of that, we're walking around encountering other people like our elders or people who might be more vulnerable with hypertension or whatever, who can get sick more easily. Those people might get a higher viral load. A viral load means how much in the plasma of the virus there is, and people with a higher viral load do end up with a more severe infection. And because an asymptomatic carrier has no idea that they're carrying it, it's easy for them to give it even up to 2 weeks, because the incubation period can be that long before the person even sees symptoms. Wearing a mask is one of the ways that you prevent yourself from giving it to others by coughing, singing, laughing, right, doing something that causes respiratory droplets to come out. But wearing a mask yourself and some sort of eyewear will help prevent you from getting it. Washing your hands only prevents you from picking it up from the surface and bringing it home. Does that make sense to everybody? I'm seeing a lot of questions here on the right. So I want to make sure that we get to everything. Pastor Corey, I'll follow your lead.
What about, so we can wipe down packaging, but what about fruit? Is just washing fruit off before you consume it good enough? Or should you do something else, like with an apple that you get from the store that's sitting out that other people have touched?
Yeah, so that's a really good question. And Dr. March did a whole talk on just going to the store, how to go to the store, how to use a credit card, how to whether to avoid using cash, how to make a mask. All of that is on either our Facebook or Dr. March. You can chat with me now and let me know how people can access that talk, because I think that's useful information. But for fruits and vegetables, what we would do is, first of all, not put them in plastic packaging. Do you know how people normally put them in plastic bags and then put them in their cart? Any surface is going to have a risk associated with it. So don't put them in plastic bags. Bring your own paper bags or a bag itself that you can easily wipe down, like your own plastic hard bag. When you bring those fruits and vegetables home, we always recommend that you keep them in a big dish, fill it with warm water, add a capful or two of white vinegar, which will neutralize any sort of pesticides and over time will kill a virus. You can also wash them with soap and water. I do that with all my fruits and vegetables because we can't know if they've been exposed to pesticides and then dry them and put them away. It's frustrating and annoying, but it's the only way to make sure you're not bringing a virus home. And that's one of the reasons why it's not a good idea to go that often to the store. Somebody asked about distinguishing COVID symptoms from the flu, but I want to make sure that you didn't have something else, so that we're not running up on time, Pastor Corey.
No, we can go to that. We can go to that.
Okay. So in terms of distinguishing COVID symptoms from a flu or allergies or something else, it's really hard to distinguish it. If you have a regular flu or if you have a virus like COVID, you're normally going to be able to take care of it, meaning you can be managed at home. It's not a smart idea to go to a walk-in clinic and get tested. It's not a smart idea to go to the emergency room. It's really actually dangerous for you. The best thing to do is to call your primary care doctor or call us, or you can go to mcura.com, and I'm putting it on here. They're a local clinic where you can create a patient profile and a nurse will call you and screen you over the phone. And that person or us or your PCP will determine how you can manage at home. The best way to manage at home is to watch your temperature, stay hydrated, do all the things you do for a cold or flu, which is rest, fluids, and some basic immune care. And isolating is really important. So again, there's a CDC handout on how to isolate, but if one of your family members happens to be sick, you really do need to keep them in a room by themselves, preferably with their own bathroom if you can, although that can be hard.
One of the questions also, Dr. Roy, was warm weather and how that can impact or not impact the spread of COVID-19. Is there any scientific evidence or proof that a warmer climate can actually slow down the spread of the disease?
So not really. Warmer climate in the sense that people have more hardy immune systems, but the virus doesn't necessarily respond to heat or cold, so far as we know. Okay. I mean, yes, very high temperatures. So if it's in food and you microwave it, sure, but it's not necessarily going to change how you and I respond.
Got you. And there's also this other thought, and I was just looking at a video yesterday. There's also this thought about herd immunity and how that comes into play, because there's some people, as you know, maybe not out of scientific evidence, but there's some people that are saying that we should not be staying at home, that we should be getting out, that we should be literally exposing ourselves to the virus in and of itself in order to develop those antibodies and to, it's almost like the bacteria thing. You got to pick up that negative bacteria in order to know how to fight it. And they're saying that so when we do come out of this stay at home, that there could be a spike because we have put ourselves in a position where we're not as strong as relates to our immune system against those things that come from interacting with other human beings. So can you talk a little bit about this herd immunity and any truth to it, or how does it work? And does it work for COVID-19?
Mm-hmm. So in terms of herd immunity, what Pastor Corey is talking about is we share our immune system with others. So particularly the people that are physically close to us. My immune system and my husband's immune system are partnered because what he's carrying, I'm carrying. And the reason why is critters move from one person to the other. And so, for example, you might have heard, don't take antibiotics unnecessarily. So antibiotics don't work for a virus. They're for bacteria only. Oftentimes people take them and they take them unnecessarily. When they do that and they don't complete the course, what happens is the bacteria in their own body develop a resistance to that antibiotic, and they become kind of really strong gorilla bacteria. And then when we sleep with the person we love, that we share that bacteria with our partners. And they become resistant to the same drugs. So in that sense, herd immunity is really important because we're sharing our immune system with others. So what we do for ourselves can benefit others, and what we do for ourselves can hurt others. Is that kind of where you were going, Pastor Corey?
Yes, yes.
Did I answer it?
Well, I'm just wondering, are we hurting ourselves more by staying away from others in society, or is it because I know that sheltering in place can help prevent, but long term, how does it impact us by staying away from other people?
I don't think it's going to impact us long term in affecting herd immunity negatively. I think how it's impacting us, and here we can start to talk about stress and maybe move towards where you want to close. I think how it's impacting us is psychologically. I think, and I do think our psychological, spiritual, and emotional health has a huge impact on our immune health. In fact, they're directly correlated. People with a strong spiritual health tend to have a stronger immune system. And the reason why is the cells in our body respond to the world around them by what we hold in mind and heart. So our spiritual lives and our psychological and our emotional lives are so critical. And social distancing, the impact it's having on people financially, the impact it's having on people to enjoy life and to commune. So graduations, Easter, Ramadan, Eid, Passover, all of these things are happening around this time. And our church services, our musical events, our support groups, in particular for people who are struggling with addictions, and people who regularly attend 12 steps or regularly attend small groups where they get that kind of support. People who have a gym membership but they're really reliant on classes or yoga, those kinds of things have been taken from us. And it's really, I think, almost incalculable how big of an impact that's having on our collective spiritual, emotional, and psychological health. And what we know evidence-wise is that has a big impact on how our immune systems respond. So I think in that way, yes. I would say that for myself, Pastor Corey, I've noticed a lot of things with the social distancing, with the changes that are happening, that I've had to rely more so on my faith than I ever had prior. And in some ways, it's really enhanced my ability to listen with a different ear to God's voice. And it's been very painful. It's been painful to not have all these distractions the way I did before. I've started to be able to see where I may be an excellent doctor. I may not have been an excellent wife. I may not have been an excellent friend. I may not have been an excellent sister, for example. And being able to move into that space, almost like reframing it, like thinking about this as an inward journey, a time for inward journeying, can be a way of reframing that the way distancing is impacting our spiritual health. Am I making sense here?
No, you're right. You're right on point. And it sounded like you've been listening to some of my messages on Sunday mornings as it relates to that, because I've been letting our congregation know, and those well-wishers and friends who have joined us on Sundays, to take this time to reflect and to introspect, and then to prepare yourself for what is going to be a new normal. And so this is a great time to be still, to listen to the voice of God in a unique way, and then to see how we're going to move forward, because as I told our group, COVID-19 won't last always in the way that it's impacting us, but what is going to be the long-term impact that it does have on us by helping us to see life in a different way and becoming that better spouse, or becoming that better parent or friend that you talked about. So for us, we've been talking about that for the past few weeks, and so thank you for sharing that portion as well. It looks like we've gone through the questions that I had that were given. I was wondering if there's anything else that you would like to share or to close with, or is there anything in the chat that we missed? If you did not, well, there's something in the chat right there that came up.
So this is a good time for people to throw their questions out there, and we'll answer these as we go. For how much longer do you want to go for, Pastor Clay?
Let's go for about 15 minutes or so.
Okay, yeah. So for 15 minutes or so, we'll listen to the person you're seeing in the background is my IT person, by the way. I almost texted the whole group that my power was dying on my computer. Apparently, I don't know how to put the cord in.
Well, we don't want to have the Teddy Riley babyface interaction here. Then, where somebody's power goes out.
Right. If you didn't get tested for COVID but had some of the symptoms and have been 8 weeks symptom free, should you get the antibody test? It depends on who you're exposed to. So if you didn't get tested for COVID, you do think that you were exposed and you're exposed to someone in your home environment who you think may be at risk. An example would be, I had a patient who may have been COVID positive and her husband was a firefighter and a paramedic. So it was really important that she get tested. I don't think it's appropriate for everybody to get tested. I think, one, it keeps us out there in the community, in contact with people. The test has a 30% false positive rate. It needs to be done more than once to really get an accurate result. And it really, for most of us who are relatively well, it's not necessary. Unless you are putting somebody else at risk, then you should get the test for that reason alone. In my case, I might have had an exposure, so I quarantined for 6 days, which is really the time you need to really start testing. Then I tested and then tested again a week or two later and quarantined that entire time. So it really depends on the person. Again, contact us or Ancura or your primary care doctor to find out whether it's appropriate for you to test. What are your thoughts on steaming or vaporizing? So vaporizers, I just worry about having a really clean vaporizer. You don't want to develop mold in that unit itself. But I think steaming is appropriate if you're doing it new every time. So for example, remember I talked about the neti pot. The next thing you would do is take that cup, wash it with soap and water, fill it with hot water, add 10 drops of eucalyptus, put a towel over your head, steam over that for maybe 10 minutes, then put a tea bag in there. And the tea bag should be something like throat coat tea from traditional medicinals. I'll write that in. Or a cold and flu tea for traditional medicinals. All of those are available to you online or at the grocery store. Now, if you were our patient, we would formulate teas specifically for you. We would have those made from whole herbs on the West Coast where we can trust pesticide exposure, and we would have that delivered to you. But you can also buy teas that you would then drink with that 10 drops of eucalyptus that you just steamed over. And yes, that's very helpful to help introduce those healthy essential oils that are antimicrobial into your lung space. As restrictions are lifted, should we still be cautious? Yes, restrictions are being lifted because of socioeconomic reasons and political reasons. If they could keep those restrictions in place and keep everybody from rioting, then they would do that for several more months. So it's really problematic that they're being lifted because we are going to see, particularly for the Black community, a big jump. And it's troublesome. So we'd like to see that people reintroduce cautiously and try to continue to implement, obviously, the steps of face covering, eye covering, and hand washing.
Is that something, Dr. Roy, that you would do even when the restrictions are lifted?
Oh yeah.
Say if they're lifted on the 28th of May here in Michigan, are you still going to conduct your practice in the way that you're conducting it now for an extended period of time?
Yes, through July at least. We'll still telemed, we'll still see critical patients at home, but through July at least, until I see on an upper level, and of course we get medical data through different sources than perhaps the public does, unless I see that there isn't any politics around the release. I think for Amplify, if I would advise you, and I could advise you, you would just keep a distance. I would definitely have a tabletop when people walk in with hand sanitizer, mask, and then I would have people stagger at the pews. I think it's really essential to do that. I think it's dangerous to go right back to what we thought was normal. And not because a virus is that big of a deal, but because it's hitting us so hard as Black folk. When we're talking about these numbers at the beginning, to circle back, when Pastor Corey and I were talking about 70% of the deaths in Louisiana are in Black people, or 60% in Michigan, or 70% in Chicago, we're talking about how disproportionately this virus is affecting us. And I can't say that a lot of resources and energy are being targeted in the proportion they should be towards educating and protecting Black communities, which is in and of itself a disparity in care and a tragedy. Because we are American citizens, our national resources are being dedicated to it, and it's not being allocated appropriately in urban centers.
And we see it even with the digital divide, where, when schools were let out, that there were really not a lot of provision for students who did not have Wi-Fi access at home. And so without that Wi-Fi access, when we say, well, we're going to put information on the web for you to read, first of all, that's problematic because everybody's not going or can't access the web sites to actually read information. And if they can, another issue, Dr. Roy, that we won't have really time to jump into today, but I'm sure that we can do this again at some point.
Part two, sure.
It's the real issue with the inability to read. And so the illiteracy rate is tremendous among African Americans in the city of Detroit. When you have a 50%, as the last numbers indicated, 50% functionally illiterate rate, those people who are in society, who may be working, who may be functioning, but can't read well, when we only put information in written form, that becomes problematic for people. So we need to have forums like this where we can voice and speak to the things that people need to do, as opposed to just putting them in writing. Your thoughts on that?
I think in Black communities in particular, it's becoming a crisis in our healthcare systems. And I think one of the things, the programs that needs to be implemented is something called citizen health soldiers. Now, I didn't come up with this, Paul Farmer did. He's a white doctor who was out of the Harvard system, but he worked in communities of color where there was less access to care, and where communities were interdependent. And he came up with something called citizen health soldiers, which is where you identify people in the community. For example, Chanel, I'm not going to pick on her, but Chanel is a wonderful example of someone who's really has a heart for wanting to educate others, has a background, at least in some aspect of healthcare, and has personal experience with our community. And you identify those people, educate them on strategies for prevention and knowledge dissemination, and then have them go out and create a ripple effect and educate 5 more, and so on and so forth. And that's actually a standardized or a constructed curriculum. And I think having citizen health soldiers as a paradigm that we introduce into cities around prevention of hypertension, diabetes, heart disease, and cancer would take such a huge burden, not just off of the system, but off of Black communities in general, who are disproportionately robbed by poor health outcomes. I mean, cancer affects Black people. It first of all happens more frequently. It responds poorer to treatment, and outcomes are poorer. Why is that? And that is because our drugs are tested on white populations. It's because of disparities in how we're delivering that care, meaning doctors don't know how to deliver that care appropriately to Black populations. It's because we're not partnering Black people with integrative medicine doctors like myself, who can give them the support they need to survive that drug treatment and do well with it. And it's because they're not educated on lifestyle choices that can help them to prevent those diseases and improve their survivorship long term. So it's distressing and it's frustrating, and it is a mission, I think, as our practice moves forward. And I've only been in practice now for, my husband and I were arguing about this, as I told you the other day, I think maybe 7 or 8 years, so I'm relatively new to practice, although we have 2,000 patients now, which is a huge practice. I'd like to see us move into that field of care where we're really looking at prevention.
So there's a question that popped up. I don't know if you saw this, about Beaumont Hospital Laboratories will not allow me to wear gloves when I enter the building. Should we wear gloves when shopping or in public? What are your thoughts around wearing gloves?
That's so curious. Are those your gloves, I wonder? So I've been told that wearing disposable gloves, if you wear viruses, will remain on the glove longer. So yeah, I mean, you really need to be throwing those away, which does create another burden on our environment. However, you can wear winter gloves, then fold them inside out and throw them in the laundry machine, or leave them in your car on the floor and pick them up again a couple of days later, maybe 3, 4, 5 days later when you go shopping. It's helpful only for a couple of reasons. One, it reminds you not to touch your face when you're out in public. Two, yes, the virus will remain on your gloves, but not on your hands if by mistake you do touch your face after you take those gloves off. So it's just another layer of protection, but not that useful because the gloves then have to be dealt with as a surface that's been contaminated. When we first started out with this virus, I recommended that my patients use winter gloves, but as the virus has evolved, so have our precautions and our protocols.
Now, about masks, you know, I know that you said Dr. March had placed some information online about masks. We've witnessed various types of masks, satin masks, cloth masks. People are coming up with different ways to make money off a mask, you know, or really a simple bandana. What type of material is best for a person to wear out in public, so that they can, if they have the virus, prevent themselves from giving it to others, at least, you know, percentage-wise, the best way possible? Or, you know, is there, well, just answer that question, if you will. What type of material should be used?
So I think breathable cotton is best. A bandana is fine, or an old T-shirt that you can turn into a mask. If you go on Etsy, ETSY, they have some artisans who will make natural or masks out of natural fibers. It doesn't matter as long as it's washable or easily reusable, and it's something that you can breathe through appropriately. I've seen a lot of like really heavy velvet, satin, a lot of designs on them. That can be harder on you to be able to breathe. It's harder to keep those clean, and you do need to be able to wash them. So it's helpful actually to use old T-shirts and just make your own. Mm-hmm. I don't want people using medical masks. One, we're running out and we want to keep that supply. Two, they're not healthy fibers really for you to be breathing for long periods of time.
Yeah, and someone, it was Carol who wrote, well, face shields do the same as a mask. You know, that's something that we're experiencing in the hospital. That, you know, when you're interacting with COVID positive patients, you will see both the mask on, but then the face shield is there for eye protection. Am I right?
That's right. Because even singing, laughing, talking can transmit. Also, the virus can shed in skin cells. So distancing is still important, even with a mask and eyewear. Okay. Again, I want to emphasize not everybody is going to get this virus, and if they do, not everybody is going to have serious consequences from it. But I also want to say that I think there is so much information coming out that does scare people. And I think fear is a great breeding ground for a lot of things, but one of the things it's a great breeding ground for is faith. It's really important to move into our faith as we experience fear, and to actually see it as an opportunity. Every time you're afraid, to be able to move into faith. And that doesn't have to be for you faith in God if that's not something that you're comfortable with, but it has to be faith in something. We all need to have faith in something bigger, something outside of ourselves. It could be the universe, it could be nature, it could be whatever you call it, but there has to be a relationship with something greater than yourself. I talk to my patients all the time about how we are not our bodies, we are our souls. And our body is sort of this vessel or this vehicle that we have been assigned to as a classroom to work through and walk through in this life and in this life alone. But if you take away this beautiful hair, I'm still Sheba. If you take away my eyes, I'm still Sheba. If you take away all these fancy clothes, I'm still Sheba. If you take away my skin, if you burn me from head to toe, I'm still Sheba. Underneath all of this is my soul, that beating soul. And that is the place that we really need to be going whenever we see these health crises with these epidemics.
Beautiful. And as you see, if you take away all my hair, I'm still Corey. So, so I agree with that statement. All right, so here's what I want to say. There's one more thing I want to ask you before we leave. We are at time, I believe, where we can close out. There's one more thing I want to say or ask of you. As we know, there's a vaccine that's coming at some point. Now, this is not, I'm not asking you to express pro or anti-vaccine vaccinations, but I'm asking you this. How does a vaccine work? And is it something that everybody should just dive into, or should we be cautious of it as it relates to how it can impact the individual? Maybe not a group, but an individual person. Is there something, if I have an illness and I've never gotten COVID-19, but if I had another condition, could that be harmful for me? But just how do vaccines work against viruses and when they enter the body? What can you speak to as relates to
Okay,
that?
so first of all, I want to say the following. I want to say to the people out there who aren't our patients or who may watch this online if we do post it, there is no one size fit all for any of you, right? So what works for one person may not work for another person. When patients come to see us, we spend over an hour actually doing a history, and that's everything from what you believe to how you ate when you were younger. You will see nutrition with Dr. March. You also see stress management. So we have therapists in our clinic who are insurance coverage, who manage patients for sleep disturbance, anxiety, marital problems, all of the pieces that go into why or why not we are healthy or not healthy. And then we design protocols or treatment plans specific to you as an individual. And to do that, we do comprehensive blood work that's covered by your insurance, where we're looking at not just your liver, lungs, and kidneys, but your immune system, your risk predictors for disease, whether you're going to have a heart attack in the next 5 to 10 years and why. What is the level of inflammation in your body? Is it your joints that are going faster, or is it your heart health that we need to focus on? We look at your hormonal health. We look at your nutrient status, and then we design that treatment plan to target to you and you alone. Vaccines work by so the way that the immune system works, the type of part of the immune system we're talking about is, if this is a foreign invader, the immune system will develop a lock and key. So an antibody is what this is called. This is called an antigen. So the foreign invader is an antigen. It's connected to an antibody. These two lock together, and then it gobbles it up like Pac-Man, or designates it for a Pac-Man to come and gobble it up. That's how the immune system works in a sort of simplified way. So what a vaccine is, it's introducing small amounts of enough of this antigen to the body that the body will mount an immune defense and then store soldiers that look like this for future exposure. That's why sometimes when you get a vaccine, you don't feel totally well, because you've had a small exposure to that thing, like let's say a flu virus or something like that. Does that make sense?
Yes.
Is the vaccine safe? I don't know, because one, they're pushing through a lot of normal things that would be in place to regulate these things and test for risk and test for contamination, test for a lot of things. I personally, and this is not my clinical opinion, I personally wouldn't line up for a vaccine that hadn't been tested over time for a long period. Also, I think it's a risk to expose people with developing immune systems and developing neurological systems, or people with neurological issues, to a vaccine, unless, of course, it's necessary for what we talked about earlier, which is like herd immunity. So there are some diseases like polio or smallpox, which can be devastating to communities, even more so than this virus, and we do need to immunize against, and the vaccines are long-standing. So again, it really depends on the individual in terms of whether or not people should be lining up to get vaccinated. Most of us, again, will not die from COVID. And again, if we're focusing on the fundamentals, lowering our weight, hypertension, diabetes, and heart disease, all of which are connected, all of which are essentially vessel issues. And I wish we had time for me to go over how each of those diseases work. but they're fairly simple, and they all come down to how nutrients travel through the body. If we can work on prevention there, that is the best weapon you have against being sick.
Well, thank you so much for your time and your wisdom. We here at Amplify Christian Church and everyone that's connected with us and all of your followers and patients, we thank you all for being a part of this historic event that I believe we will have room to do again in the very near future. You just mentioned there's some things that we need to still go over that are great. We want you to go to aimnatural.com. We want you to find out the great things that Dr. Roy and Dr. March are doing there. And we want you to know that we here at Amplify are concerned not only about your spiritual health, but your physical health as well. And so once again, thank you so much. Any parting words, Dr. Roy?
No, I think that's exactly what I would say. I think you can't separate out the body from the spirit. I think they're one and the same. And I think, and not just I think, but what I've seen from my work in the world, it's those of us that tend to focus on our spiritual health that tend to have the best outcomes.
Great. So thank you so much. You're welcome to join us tomorrow morning at Amp My Life on Facebook for our live virtual worship experience.
What time is the service?
10 a.m. 10 a.m. Eastern. If you're in any other time zone, 10 a.m. Eastern. We are, I know you're where you are, Dr. Roy, but anybody else that's listening, AMP My Life on Facebook, and then Amplify Christian Church, amplifychristian.church is our website. And then also we will be on Instagram as well, Instagram Live at Amplify Christian Church, all one word. So we thank you so much for taking part of this.
Is it .org or .com?
It is, our website is amplifychristian.church. So it's not an org or com, it's just .church. That's how you get to it. Yeah, okay. And then Amp My Life is our page on Facebook.
Got it.
Okay, so beautiful. Listen, aimnatural.com, check them out. Great things are happening. Thank you so much for allowing us to get greater insight on what it means to be naturally healthy and making sure that we're following those things. So God bless you, Dr. Roy, and your practice, your family. Stay safe, and let's do this again real soon.
God bless you as well, and it's an honor to speak with all of you today.
All right, and thank you to Kyle, the IT.
We couldn't have done it without him.
We needed Kyle, so thank you so much.
And thank you to Sydney for working all this out as well.
Yes, Sydney, we love you as well. So, all right, okay. God bless you. That's it from us. We'll see you all real soon.
Okay.
All right, bye-bye.